Lifestyle medicine can prevent and reverse heart disease. Is absolutely amazing. But before we get into those details, make sure you subscribe to this channel, turn the notifications on so you don't miss any of my future videos. I recently had the honor of presenting the topic Lifestyle Medicine and Heart Disease at the International Conference on Nutrition and Medicine in Washington, D.C. And I want to share with you the power this has to prevent and reverse heart disease. I started by telling my own story about how I was following the standard American diet, gained almost 100 pounds, was well on my way to the standard American diseases and the standard American death. I was waiting to have a heart attack or a stroke, and I knew I had to make a change. At the same time, I was getting frustrated in my clinical practice. I was just giving pill after pill after pill to my patients, and the patients didn't like the medications. They cost money, they had side effects, and ultimately, even if I gave them all the right medications, they might still have a heart attack or a stroke because the pills don't treat the underlying cause of the person's problem, which is an unhealthy lifestyle. As I tried to recapture my health, I made so many mistakes. I focused on exercise, weighing 270 pounds. What did I do? Signed up for a marathon. Absolutely brilliant, right? Nope, wrong thing to do. You really need to focus on diet. But then I did the wrong diet. I read the USDA dietary guidelines and I ate lean meats, low-fat dairy products, and used a lot of olive oil. And then I still ate those unhealthy foods in moderation, right? I quickly learned moderation doesn't work. Just like you shouldn't do heroin or cocaine in moderation or smoke cigarettes in moderation, things that are bad for you really should be zero. Netflix then randomly suggested that I watch this documentary, Forks Over Knives, and oh my gosh, did it blow me away about the power that lifestyle medicine can have to prevent and reverse heart disease. Changed my life and really made me very angry at our current medical system. How I was not taught this during my training blew me away and changed my life. So now my passion is with lifestyle medicine, treating the cause of the problem. I was able to switch over to a plant-based diet, lose more weight, my cholesterol came down, had so much more energy, and now that's what I want to do for my patients. So we're going to talk about the current state of the healthcare system in the United States. It's really a sick care system. We're going to go through what lifestyle medicine really is. How do we define it? What are the 6 pillars of lifestyle medicine? Then we're going to go over some key concepts about heart disease prevention and reversal and heart disease nutrition specific concepts. So let's get right to it. Heart disease is the #1 cause of death in the United States, and it has been every single year since 1918. Cancer is number 2. In 1918, it was the Spanish flu. Heart disease has been winning ever since. Yet heart disease is preventable and even reversible. Research really shows at least 90 to 95% is preventable and even more. And yes, we can reverse heart disease. It is not genetic. Look at this study that shows the polygenic scores for coronary artery disease and how lifestyle can actually affect it. So this is when they took a bunch of patients who had the highest genetic risk based on genetic testing. They then had half of them change their lifestyle and the other half just do whatever they wanted to do. And you saw a dramatic reduction in heart disease risk when people followed a healthy lifestyle. And the healthy lifestyle they recommended wasn't even all that strict. It was more based on USDA dietary guidelines. The exercise component wasn't always met. So we could probably get a way more dramatic reduction even in the highest genetic risk people. The genes load the gun, but your diet and lifestyle pulls the trigger. So many studies have really told us this. The Inner Heart trial showed that abnormal lipids, smoking, hypertension, diabetes, abdominal obesity, consumption of fruits, vegetables, alcohol, and regular physical activity accounts for almost all the risk of having a heart attack. The 40-year follow-up from the Chicago Heart Association Detection Project in industry showed that if you got your cholesterol numbers down, your blood pressure down, you stopped smoking, maintained ideal body weight, exercised enough, and ate your fruits and veggies, that you can get rid of 90 to 95% of heart disease risk. Similarly, the Nurses' Health Study showed that if you just got your diet really good, you exercise regularly, and you got your BMI within normal range, you could reduce your risk by more than 80%. And when you look at how we're actually doing in the United States, we are really doing horrible controlling diabetes, blood pressure, cholesterol, getting people at their normal weight, stopping smoking, and maintaining the proper physical activity. But how are we doing with diet? Only 1% of people actually follow the proper dietary pattern according to what's called the Healthy Eating Index. And guess what? That's based on the USDA dietary guidelines, which we know is not ideal for overall heart health, right? So way under 1% of people are actually following the proper diet, which should be a predominantly or exclusively whole food plant-based diet, using plant-based proteins instead of animal-based proteins and focusing on all unprocessed foods. And in the United States, we spend more money per person, more money per capita than any other country on healthcare. The United States towers over all other countries in regards to the percentage of our economy that we spend on healthcare. And you would think with all the money that we spend on healthcare that we must be healthy, right? Nope. According to the World Health Organization, the United States is dead last in life expectancy amongst industrialized nations. We need an absolute paradigm shift away from pills and to plants, away from the pharmacy with a PH to the pharmacy with an F. We need to get rid of our acute care model where we have short appointments, we get paid for productivity, and we really don't address the underlying cause of the problem, over to a new system, an integrative approach with longer appointments, getting paid for prevention, having multiple different specialties with health coaches and exercise coaches and stress management, behavioral health management people helping every patient every time, making lifestyle the main focus. We need to flip the pyramid. We need to take the pyramid on the left, which has prevention all the way down at the bottom in orange as being a small piece of our healthcare system, and flip it so that prevention is on the bottom. On the right side, you see the pyramid with the red bottom, which is prevention now making up a majority of what we do. If we do it that way, like that right pyramid, then all the way at the top, you only need a teeny bit of tertiary care because not so many people are sick. You prevented them from needing to be in the hospital and needing advanced care. Let's look at this example. In the United States, every year, 1.2 million people get coronary artery stents implanted inside the coronary artery to open up a blockage electively. Now, I'm not talking about during heart attacks. During heart attacks, stents save lives. But electively, when somebody's having chest pain and a blockage, 1.2 million stents per year. And there's a 1% mortality rate with that intervention, meaning we cause 12,000 deaths with these stents. And there's a 4% rate of heart attacks. So we cause 48,000 heart attacks doing this. And then open heart bypass surgery, a huge surgery where they actually literally saw open the chest and take veins out of the legs and reroute the blood supply, 500,000 of those per year. With a 3% mortality rate, we cause 15,000 deaths, and a 3% stroke rate, we cause 15,000 strokes. With lifestyle medicine, we cause no strokes, no heart attacks, no deaths, and this is the way we need to shift it. And research study after research study after research study has shown that putting in elective coronary stents in patients does not prevent heart attacks or strokes. It doesn't make people live longer. The biggest of those trials, called the ischemia trial, even had many patients with severe blockages affecting a large amount of their heart. And when they used medications instead of putting in stents, the patients did fine. They did not have a higher risk of heart attack or a higher risk of death. Now, can you imagine if you actually put lifestyle medicine into that, how powerful it would be? So here is the solution. Lifestyle medicine, the 6 pillars of lifestyle medicine. We have nutrition, physical activity, restorative sleep, social connections, avoiding risky substances, and stress management. You put all these together, we can prevent and reverse heart disease. So let's get into it. The key in regards to heart disease prevention and reversal is 2 things. Number 1, getting your cholesterol numbers down, driving that LDL way down. And number 2, protecting your endothelium, the lining of the artery, from damage and inflammation at all costs. The day you're born, your arteries are nice and clean. As time goes on, the fatty streaks start to build up, and as we reach adulthood and disease advances, we clog our arteries up until a blood clot can form inside the artery, completely occlude it, and suddenly trigger the heart attack. And that's what we need to prevent. So in order for you to understand how important it is to get the LDL cholesterol down and to protect your endothelium, I wanted to show you this summary slide, which shows how atherosclerosis develops, how heart disease and clogging of arteries develops. We do need first the LDL cholesterol to be elevated. It needs to be at least over 70 milligrams per deciliter, which we'll get to. And then you need to have damage to the arterial endothelium. And all these gray boxes at the top, genetic determinants of arterial wall biology, hypertension, inflammation, smoking, diabetes, all can damage the artery endothelium, the lining of the arteries. Then the LDL starts to accumulate inside the wall of the artery. So the cholesterol builds up, gets oxidized, gets sucked up by these cells called macrophages, and then it becomes very inflamed. Then the plaque progresses and progresses. It can go one of 2 ways. It could become a harder plaque, a more stable calcified plaque, or a softer plaque, which is more unstable and prone to plaque rupture. When the plaque ruptures, then a clot forms on it, and that can 100% occlude the artery, cut off the blood supply to the heart muscle, and trigger the heart attack. And that's what we need to stop. And yes, exercise is absolutely critical. It does reduce overall mortality, it reduces diabetes risk, it reduces blood pressure, improves heart failure, can decrease plaque progression. But look at this. It only lowers cholesterol numbers by a small amount. LDL cholesterol only goes down maybe by 3 to 10 milligrams per deciliter with exercise alone. And that is why diet is the key. Exercise is still important, however. And on the flip side of things, the most sedentary people, the people who exercise the least, have a dramatically higher risk. Look at this study among 750,000 veterans in the United States. The veterans with the lowest amount of physical activity in the lowest quintile, the lowest 20%, had more than a 4 times increased risk of having a heart attack. That's just the same as smoking cigarettes. So being very sedentary is the new tobacco. And this is when life threw at me an absolutely crazy wake-up call. I still cannot believe this happened. The pandemic had hit. I had moved my practice from Illinois to California. There was a lot of challenges, and I admit I stayed 100% plant-based, but let some of the processed foods back in. I gained a little bit of weight. It's hard for everybody, and I get it. But sometimes you need that wake-up call. So here was mine, no question. I had signed up for the Monterey Bay Half Marathon, November 2022. I was going to run it with my 2 older kids. It was going to be their first half marathon and our first time running an event live since the pandemic hit. It was a beautiful morning. We were really excited. At mile 3 into the race, I saw somebody go down right in front of me. He fell completely out, and as I approached him, I realized it was a full cardiac arrest. Started CPR really quick and called 911 for a defibrillator. It ended up being Greg Gonzalez. He collapsed completely and was in ventricular fibrillation, a fatal rhythm. We were able to do good CPR, and eventually when the defibrillator arrived, we shocked his heart back to a normal rhythm, and he eventually woke up, and we got him into the ambulance on his way to the hospital. I called the ER, and the interventional cardiologist frazzled, let him know what happened, but then I thought to myself, well, what else can I do? He's in good hands, let me keep going. After I crossed the finish line, oh my gosh, another runner went down right at the finish line, right in front of me. And again, I knew this wasn't good. It was a full cardiac arrest. He had no pulse. He wasn't breathing. Michael Heileman was having a cardiac arrest. His rhythm again, fatal ventricular fibrillation. A defibrillator arrived within about 1 minute, hooked him up, 1 shock, and his rhythm came back, and he woke up quickly, stopped the Strava on his watch, and said, I need to get up. I looked at him and I said, no, man, you just died. This is them meeting each other for the first time on the Today Show. It was very emotional and an absolutely beautiful moment. Then I got to reunite with them for the first time also here on the Today Show. And we had a wonderful discussion about how unlikely this was to happen. Only about 1 in 200,000 people have a cardiac arrest during a race like this. There was only 5,000 participants. That makes it 1 in 40. To have it happen twice, 1 in 1,600. To both survive, crazy, because only 30% of people survive a cardiac arrest during a race. To have the same cardiologist behind them both right when it happened, absolutely bonkers. I was so blown away that things happened the way that they did. I was so happy that both of them made a full recovery. They both had severe coronary artery blockages in their left anterior descending from plaque buildup. Both ended up getting things fixed and made full recoveries. It was great. It was wonderful. And as I realized this was going to start making national and international news, I said to myself, hey, I want to use this opportunity to spread the power of lifestyle medicine and how important it is not just to exercise, but to eat healthy. Because both of these runners were doing a lot to exercise and they felt great. They didn't quite follow the diet that we would say is optimal for overall heart health, a predominantly or exclusively whole food, plant-based diet. So I said to myself, as we go through more interviews and spread this message, I want to make sure people understand the power of diet and lifestyle. Exercise is important, diet is critical. Unfortunately, it became clear to me as more and more places published this story, like the Washington Post and Runner's World, nobody wanted to talk about diet. Everybody just wanted to focus on how miraculous this was. And yes, they talked about learned CPR, but it was all about just sensationalizing the whole general story. And I was disappointed that the proper message wasn't really spread, because it's great to get somebody back from a cardiac arrest. It's even better to prevent it in the first place. Now, I was happy that some places like the American Heart Association and the American Medical Association, when they wrote their articles about the whole crazy story, they did talk a lot about plant-based diets and how important diet is. And the Daily Mail, they don't shy away from it, right? They went through my Twitter feed. They put things up like when we protested in front of McDonald's, saying bacon causes butt cancer and processed meats cause heart disease. They showed all these different things. So I was happy that they helped to spread the proper message of lifestyle medicine. Now, Greg and Michael have become good friends of mine, and we have been speaking at different places trying to promote learning CPR and lifestyle medicine. And they do plan on running the Monterey Bay Half Marathon again with me this coming fall, 2023. I plan on having one sign in one hand that says eat plants and the other sign that says learn CPR with a defibrillator around my back. It's going to be a wonderful reuniting of all of us. Certainly can't wait. Now back to heart disease prevention and reversal. Yes, this was a wake-up call for me saying, listen, diet is critical. That's what we need to focus on. Exercise is good, but we need to get the cholesterol numbers down, which is predominantly through diet. Exercise only has a small piece of that. And we need to protect the endothelium from damage, which is predominantly through diet and, of course, not smoking and avoiding toxic substances. Now, don't let anybody tell you LDL doesn't matter. LDL is causal in regards to clogging your arteries, meaning if your LDL cholesterol is high, you're going to clog up your arteries. This is from the European Society of Cardiology. It's an LDL consensus statement showing that LDL cholesterol does indeed cause the buildup of plaque and overall heart disease. This table from the consensus statement summarizes the plausibility, the strength of the evidence, the biologic gradient, the temporal sequence, specificity, consistency, coherency, and reduction of heart disease risk when you intervene and lower the LDL cholesterol, showing that the evidence grade for all of these different 8 factors is the highest level of evidence. There's absolutely no question. So don't let anybody tell you that LDL doesn't matter. In regards to dietary factors and blood cholesterol numbers, the 3 things that raise your cholesterol is eating dietary cholesterol, but more importantly, eating saturated fats and eating trans fats. What diet has no cholesterol, almost no saturated fat, and almost no trans fats? A whole food plant-based diet, which is the only diet that's been shown to reverse heart disease in clinical trials. Now, many experts say that the prerequisite that you must have to develop plaque buildup and clog your arteries is an elevated cholesterol number, meaning if your LDL cholesterol is real low, that there's no evidence that anything else matters. The prerequisite that you must have to develop plaque buildup is an LDL over 70, according to many experts. So if your LDL is real low, nothing else seems to matter. Now, you hear people talk about normal cholesterol numbers being a total cholesterol of less than 200 and LDL being less than 100, and HDL, you want it higher, and you want the triglycerides less than 150. But really, for heart disease reversal and the better prevention type efforts, we want the total cholesterol to be under 150 milligrams per deciliter, the LDL at least under 70, and maybe even a little lower. The HDL numbers, really, we don't target those much. Your HDLs will come down as all your cholesterol comes down, but more important is the efficiency or the efflux capacity. And yes, having low triglycerides are good. We do that through diet and lifestyle. This is a very powerful publication in the Journal of the American College of Cardiology, really summarizing well the impact that having high cholesterol has on your overall cardiovascular health. And again, just focusing on how important it is to get the LDL cholesterol down. Let me show you. On the right side, we have the cumulative risk of having a heart attack. On the bottom is your age. And here's the way we think about this. The average American has an LDL cholesterol of 125. So if you have an LDL cholesterol of 125, by the age of 40, you have about a 1% risk of having a heart attack. By the age of 60, you have about a 4% risk. And by the age of 80, you have about a 16% risk of having a heart attack or a stroke. Now, I have lots of patients whose LDL cholesterol is much higher than 125, let's say 160. So what this shows is by the age of 40, at that level, you're going to have a 3% risk of heart attack or stroke. By the age of 60, a 16% risk of heart attack and stroke. And by the age of 80, you're off the charts. This shows the effect of the cumulative exposure to LDL cholesterol. The higher your LDL cholesterol is, and the more years it's elevated for, the higher the risk of clogging your arteries and having an event. Now let's look at the flip side. Say your LDL cholesterol is 60, and you keep it low from early in life. Then your risk of having a heart attack by the age of 40 is way less than 1%. By the age of 60, way less than 1%. By the age of 80, still way less than 1%. So the lower you get your cholesterol earlier in life, the better you're going to be decades and decades and decades later. So what are optimal LDL cholesterol levels? Well, more and more research is showing that we should really have them between 50 milligrams per deciliter and 70 milligrams per deciliter. Healthy babies are between 30 and 70, and primates between 40 and 80. We really need to keep it really low. When you look at this graph on primary prevention trials, clinical trials with thousands of patients trying to prevent the first heart attack and stroke, each one of these dots represents a clinical trial. And when you put them all together and look at what LDL cholesterol you need to have a 0% event rate, it's around 55. Now let's move to secondary prevention. These patients in these clinical trials here have already had a heart attack or stroke, and we're trying to prevent the second one. What LDL cholesterol do you need to prevent the second event? An LDL cholesterol approaching 30. We want to keep it as low as we can. Remember, LDL cholesterol can be raised by eating cholesterol and saturated fat as well as trans fats. Starting with cholesterol, we can realize that the number one source of cholesterol in the American diet is eggs. The number two source is chicken. And a lot of people don't realize that chicken has just as much cholesterol in it as beef, almost, right? But there is no cholesterol in plant-based foods. Cholesterol is only in animal-based foods. It's not an essential nutrient. You don't need to eat any. Just like you're an animal, I'm an animal. Any animal makes its own cholesterol. So eating anything from an animal, from a cow, a pig, a chicken, a fish, a turkey, you're going to get cholesterol in your diet. And do you need any? Absolutely not. You don't need any. Should we eat any cholesterol? Well, according to the National Academy of Medicine, which is integrated into the USDA dietary guidelines, they say straight out, individuals should eat as little cholesterol as possible, which lifestyle medicine people would consider zero, right? Yet they do show a pattern between 100 and 300 milligrams of cholesterol, which will raise your LDL cholesterol numbers. If your LDL is under 70, you might be okay. Again, getting it in the mid-50s, even better. But almost every American has an elevated LDL cholesterol, so should be eliminating cholesterol from their diet. How about saturated fat? Now, saturated fat has an even more profound effect on raising your LDL cholesterol numbers. The number one source in the American diet is cheese and high-fat dairy products, but there is a lot of it in beef, which is one of the reasons why red meat is considered so unhealthy, along with the cancer risks associated with red meat. Yes, white meat has less saturated fat, but as we just saw, there's still a lot of cholesterol in it. And we do know that the tropical oils are very high in saturated fat, not good for you. Yet plant-based foods, extremely low in saturated fat. Is there any safe amount of cholesterol, saturated fat, and trans fats that you could eat? Well, according to the National Academy of Medicine, previously known as the Institute of Medicine, they did not set an upper limit for how much cholesterol, saturated fat, or trans fats is safe to eat, because any amount that you eat above 0% of energy will raise your LDL cholesterol number. Any amount. So you need to get it as close to zero as you possibly can. And it's just like smoking cigarettes, right? They don't say cut back the cigarettes that you smoke. They say don't smoke any cigarettes. You don't need to smoke to live. You don't need to eat cholesterol to live. You don't need to eat saturated fat to live. It's not an essential nutrient. Get it as low as you possibly can. Now, I think we talked enough about cholesterol and saturated fat and LDL and how important it is to get it down. Let's switch over to protecting the endothelium at all costs, the single cell lining of your arteries. If it becomes inflamed and your cholesterol numbers are high, that's when you can get your arteries narrowed by the atherosclerotic plaque buildup, which we need to avoid. It's not just cholesterol and saturated fat. It's the damage and inflammation to the arteries that's important. When you eat an animal-based food, an animal-based protein source such as meat, you're going to increase lots of different factors that damage and inflame your arteries. TMAO, trimethylamine oxide, heterocyclic means, heme iron, new 5G, advanced glycylation end products, and endotoxins all come with the consumption of animal-based protein sources. But when you eat plant-based protein sources, you get fiber, you get vitamins, minerals, and all these phytonutrients and antioxidants that are anti-inflammatory. So that's why the plant-based protein sources are so much more powerful, not only because they don't have cholesterol and saturated fat, but they are anti-inflammatory and antioxidant, which you don't get when you eat animal-based foods. And just the opposite, the animal-based protein sources are pro-inflammatory and pro-oxidant. So avoiding inflammation is critical. And in this study, it looked at different foods and what actually causes inflammation. And in this study, which was very well done, it showed that a higher intake of red meat, processed meat, organ meats, refined carbohydrates, the white flour products, and sugar, sweetened beverages, increased inflammatory markers. Well, on the flip side, eating green leafy vegetables, dark yellow vegetables, whole grains, fruits, and a lot of other plant-based foods decreased overall inflammation. And so that's the most important thing. But what about white meat? What about lean meat and fish? Well, let's look and see. This was a great study published in the Journal of the American Heart Association, which actually took patients who had heart attacks or what we call acute coronary syndromes and had high inflammation markers such as C-reactive protein, randomized half of them to a whole food, plant-based vegan diet, and the other half to the American Heart Association diet. What's the American Heart Association diet? Well, it's relatively healthy and better than the standard American diet, but it includes some low-fat dairy products, a little bit of eggs, a little bit of added oils and fats, and about 3 ounces or less of cooked meat, focusing on white meat and seafood. So pretty healthy, but still some significant amounts of animal-based foods and animal-based proteins in there. And what they found was the vegan group, the whole food, plant-based group, had a significant, dramatic reduction in C-reactive protein, whereas the American Heart Association group only had a slight reduction. And remember, C-reactive protein is an inflammation marker very highly associated with developing clogged arteries, having heart attacks, and strokes. So the whole food plant-based diet was superior to the American Heart Association diet, which had only little bits of lean meat and low-fat dairy. So there you go. It all causes inflammation. That's why 100% plant-based is ideal. And I can't do a presentation like this without mentioning the ketogenic diet. There's lots of research that shows that ketogenic diets increase LDL cholesterol and increase inflammation markers dramatically. It's considered the most unhealthy diet in regards to heart health. Here's a good study done by Mayo Clinic where they took patients and put them on a ketogenic diet. Their baseline LDL cholesterol was around 125, and about a third of people called hyperresponders had their LDL cholesterol increase to over 300, a dramatic increase, and that is exactly why we want to avoid the ketogenic diet, along with the inflammation potential. The ketogenic diet is ranked by the U.S. News and World Report as the absolute worst diet for heart health. 24 out of 24 out of all the diets that they ranked, the worst. So avoid it at all costs. And again, it's not just cholesterol and saturated fat. This big study published in the Journal of the American Medical Association showed that replacing only 3% of your energy, removing the animal protein, putting plant protein in instead, significantly reduces overall mortality and heart disease mortality. And a lot of that was associated with egg-based protein. So get the animal protein out and put the plant protein in. So again, to summarize, drive your LDL cholesterol down to under 70, protect the endothelium from damage and inflammation by eating more unprocessed plant-based, and that's the way to be. The closer to 100% you get, the better your artery health will be. It's important to realize this statement from the American Academy of Nutrition and Dietetics that a 100% whole food, plant-based diet, whole food vegan diet is nutritionally adequate for all stages of life as long as you keep it well balanced, unprocessed, and adequate calories. You're going to be fine. Remember, everybody over the age of 50 should be taking vitamin B12 because absorption goes down over time, and plant-based diets are lower in B12 because we wash all the bacteria off our plant-based foods, which normally contain the B12, but animal-based foods are very dirty, very bacteria heavy, and you can't really wash that off. So take your vitamin B12 when you follow a 100% plant-based diet. So how does all this look when you put it into clinical practice in a clinical trial? Well, Dean Ornish did that. He took patients with heart disease and put them on a whole food, plant-based, low-fat diet and randomized half of them to his program and the other half to usual care. When only clogging of arteries of 50% or more were analyzed, going on the Ornish diet, 100% plant-based, low-fat, showed regression of disease, reversal of disease, whereas it progressed and got worse in the control group. And so they concluded that comprehensive lifestyle changes may be able to bring out regression of even severe coronary artery disease, and this was after only 1 year. There's even more regression of coronary artery disease after 5 years than 1 year in the experimental group, the group that actually followed the plant-based diet. Whereas in the control group, it continued to progress and more than twice as many cardiac events occurred. So continue to be as close to 100% whole food plant-based as you can and keep it low in fat. And this is why the guidelines from the American Heart Association and the American College of Cardiology in regards to prevention of heart disease emphasize that a plant-based diet is the recommended dietary pattern. So follow plant-based, it's in the guidelines. But what about a Mediterranean diet? I thought Mediterranean diets are really good for your overall heart health. Well, according to the PREDIMED trial, they looked at a combination of heart attack, stroke, and overall death. And yes, there was a reduction compared to the control diet, but this was driven mostly by stroke reduction, not heart disease or heart attack reduction. So you could essentially say, based on this, that a Mediterranean diet does not prevent heart disease or heart attacks. Unless, that is, when they reanalyzed the study, they looked at people who followed a pro-vegetarian food pattern with the least amount of meat, least amount of animal-based protein, and guess what? There was a reduction in heart attack risk. So the only type of Mediterranean diet that can prevent heart disease is what we call a pro-vegetarian Mediterranean diet. And it did lower the risk, but the more of those animal-based foods you get out, the lower your risk will be. So let's look at this study, the PREDIMED study, and let's look at the most common graph that people talk about. The control diet is at the top there in gray. The Mediterranean diet with nuts or with olive oil is in orange or green. And what we think about is what's called residual risk. The shaded area here shows all the people who still had heart attack, strokes, or died on the Mediterranean diet. Sure, it was better than the control diet, but there was still a lot of residual risk and people dying of heart attacks and strokes, and we don't want that. Now, if we were to put a whole food, plant-based vegan diet, an Ornish diet in here, we would see a line that's way down there, and the residual risk would be dramatically lower, really showing that a whole food, plant-based diet is way better than a Mediterranean diet for overall heart disease prevention and reversal. Now, to summarize the power of lifestyle medicine, remember, lifestyle medicine is what we want to do. Heart disease is preventable and even reversible. Only 1% of people in America eat healthy. Even less than that eat whole food plant-based. We have a lot of work to do to get people to eat more plant-based. Exercise is important, but diet is absolutely critical. We need to focus on our diet for heart disease prevention and reversal. Some of the key concepts: lower your LDL cholesterol as low as you can, at least under 70 milligrams per deciliter, but even lower is better. And prevent any damage to your endothelium. Prevent the inflammation at all costs. Don't let anybody tell you that LDL is not important. Look at that European LDL consensus panel statement. It's very powerful. And avoid the ketogenic diet at all costs, which increases inflammation and increases your LDL cholesterol numbers. Remember, there is no safe amount of dietary cholesterol, saturated fat, or trans fats. Any amount that you eat above zero will raise your LDL cholesterol numbers. And remember the statement from the American College of Cardiology and the American Heart Association. It's in the guidelines to recommend a plant-based diet for the prevention of heart disease. And don't let anybody ever tell you that, what about this nutrient, what about that nutrient? The American Academy of Nutrition and Dietetics has that statement that a 100% whole food plant-based diet, as long as it's well balanced, enough calories, and unprocessed, is nutritionally adequate for all stages of life. So you can get everything you need. A whole food, plant-based diet is the ideal dietary pattern for heart disease prevention and reversal. Thank you, everyone. I hope you enjoyed this talk on the power of lifestyle medicine and heart disease prevention and reversal. Don't forget to subscribe to the channel, check out heartstrong.com, and keep on eating those plants and spreading the powerful message that lifestyle medicine can prevent and reverse heart disease.